Well, we've all heard about the crisis of heroin and opioid addiction. Experts tell me it's hitting the nursing profession hard. Records obtained by Action News Investigates show the number of state sanctions against nurses for using drugs is soaring. One nurse told me she ended up treating patients while she was high on heroin.
I'm an addict, and this is who I am.
She is also a nurse. She agreed to talk to Action News Investigates if we did not reveal her name. She got hooked on painkillers after a car accident several years ago, and the pressures of her job made it even harder to quit.
I would be on 12-hour shifts, but I'd be working 14 just to get my charting done. It was difficult. It was very difficult.
She did take some drugs from her workplace, but she worried about getting caught. So she turned to heroin.
I would leave on my lunch break and go get what I had to get because I was right in Oakland, so it was right there.
You would go and snort heroin on your lunch break?
On my lunch break.
And then you go back to treating patients?
Go back to work.
Eventually, she did get caught with a bad drug screen. Her license was suspended, and now she's getting treatment. She's not alone. Records obtained by Action News Investigates show Pennsylvania sanctioned 179 nurses for drug-related offenses in 2014, the most recent year available. That's a 30% increase from just 2 years earlier. And there are 1,100 nurses in treatment programs overseen by the state. Dr. Neil Capretto at Gateway Rehab says nurses have a high-pressure job with easy access to powerful drugs.
There's certainly nurses dying from drug overdose deaths, and sometimes it occurs even in hospitals.
Action News Investigates found multiple cases where nurses diverted drugs from Pittsburgh hospitals. One nurse even did it at 2 different hospitals. In 2010, Nurse John Livingston admitted taking the painkiller fentanyl from Allegheny General Hospital for personal use. He pled guilty to drug possession and went into treatment. The state nursing board put him on probation, which allowed him to get another job at UPMC Montefiore. But in December 2014, Livingston was seen staggering around Montefiore's transplant ICU, glassy-eyed, confused. The hospital fired him after he refused a drug test. He later admitted diverting fentanyl and was again convicted of drug possession. Last year, he surrendered his nursing license. Also last year, nurse Laura Zawisland pled guilty to multiple drug charges after she admitted diverting oxycodone, Xanax, Percocet, and other painkillers from Allegheny General Hospital. Laura Zwirek, a nurse anesthetist, was given probation after she admitted diverting fentanyl at Mercy Hospital. So are patients being harmed by nurses on drugs? Action News Investigates put that question to the state official who oversees nurses and other licensed professionals.
That's relatively uncommon for nurses to cause any harm to patients. For the most part, what we see is that nurses are particularly harming themselves.
Capretto agrees, but he says sometimes nurses will take drugs meant for patients, possibly causing those patients to suffer. The nurse we interviewed said it does happen.
I was here with somebody recently that, said her patients got water or saline instead of their Dilaudid.
As horrible as that sounds, Capretto says firing nurses too quickly could hurt patients even more.
Unfortunately, that doesn't make drug use go away. That's just going to make it go underground, and actually the public is going to be worse off.
This nurse is vowing to stay off drugs and eventually return to patient care.
I'm an empathetic person, I'm caring, I'm giving, and I'm intelligent, but I'm also an addict. And hopefully, I can put that